Hello friends. Today we are going to discuss about autism in adults. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about autism in adult population, the prevalence, comorbidity, and treatment. Autism is also known as autism spectrum disorder in the newer classification system such as DSM-5 and ICD-11. It is well known it is a lifelong neuro-developmental disorder. Although earlier the research in autism focused only in children. That is, the main reason being our classificatory system did not allow diagnosis of autism in adult population. Hence, the evidence was very less. And since there was no evidence and research, the policymakers did not think about autism in adult population. Hence, health services and rehabilitation services did not improve in many of the developing and developed countries. The estimated life cost of supporting a person with autism spectrum disorder is very substantial. In US, it is $2.4 million, my dear friends. In UK, it is 1.5 million pounds. It is a very costly disorder. Unless the welfare states takes responsibility, this burden will fall on the parents. Now let's understand the diagnosis of autism. Invariably, the pathognomonic feature of autism revolves around social and emotional reciprocity deficit. At the same time, they also have deficit in nonverbal communication and behavior, deficit in developing, maintaining, and understanding relationships with autism is a big challenge. They have a restricted, rigid, repetitive patterns of behaviors, interests, or activities. They also have either hyper or hypoactivity of certain sensory inputs. Conservative in diagnosis, especially childhood autism, are diagnosed. Unfortunately, now also, many of the psychiatrists and pediatricians do not believe autism can be diagnosed for the first time in adults. This conservative approach of diagnostic classificator system has been a big challenge for providing services for adult autism. And we need to change our mindset in this regard. Adult also will suffer from autism when they are not diagnosed in childhood. Hence, we need to entertain this possibility. There are many mild autism or high functioning person with autism. Invariably, they go undetected in families and especially in societies where mental health human resources are very less and access to services are minimal. In such a scenario, there is a high possibility a child with autism will grow without even getting a single consultation with a mental health professional. Further, professionals such as pediatrician, nurses, and various other health professionals are not trained in neurodevelopmental disorders, including autism. Now let's understand autism in adults. If you look at this autism in adults diagram, which clearly talks about there is the depression in autism, especially with persons with autism, it is 3 times the general population in US. Further, most of the adult with autism still they reside with their parents. That means they are dependent on their parents. And 1 in 4 of them are unemployed and uneducated. Further, 1/3 of them have epilepsy, that is seizure. And many young adults with autism don't receive any health care in spite of being diagnosed as autism in childhood. And further, an estimated 5% of the adult with autism will never get married or else they remain bachelor in their life. And many a time, they have difficulties with regard to relationship, especially with friends, relatives, sibs and family members. And this causes depression and also they feel lonely and isolated. Further, if they try to get employment, most of the uh, persons with autism do not get employment. Majority of them, they became dropout from the high school. The main reason being is the person with autism will be considered as unique or else weird, and most of the so-called normal children start bullying them, abuse them, and invariably the person with autism will drop out of schools. If you look at autism in women, is still most worrying. Invariably, poor social skills will add to the burden of the restriction of women in various society. They are considered to be very polite and they need to follow the social norms. Many a time, a person with autism, especially being a woman, and if she does not follow those rules of the culture or religion, she will be punished. Further, they also have extreme routineness, which they are inflexible, rigid, poor sense of empathy, and this becomes a very big challenge for a woman. Invariably, majority of the society thinks women has to be very sympathetic towards other people. Invariably, a person with autism, especially being a female, they find it very difficult to empathize with other people, and many a time they are sensitivity to sound, fixation of certain topic of interest, and prolonged emotional response, agitation, aggression, and challenging behavior. Not only that, majority of women with autism are abused. Many a time they are sexually abused because they are victim of various physical violence and sexual violence. Suicidality is common, especially women with autism, and they are less likely to be diagnosed with autism. The reason being is the parents do not consider them that need to be taken to the hospital, and many a time, the most of the time they are silent, and invariably they go undetected with regard to the diagnosis of autism. And many a time they remain unmarried, and if they are married, they get divorced very fast. Unemployment is a big challenge for women with autism. And name the human rights, most of them are violated, especially women with autism. Let's understand the presentation of autism in adults. Autism is diagnosed in childhood, and as they grow up and they are undergoing follow up, this is the one set of population. The second set of population is the autism is diagnosed for the first time in their adulthood. There may be two reasons. One is primary reason and secondary reason for consultation. Let's look into both of them. Here, if the autism is diagnosed for the first time in their adulthood, the main reason being is the autism itself. They could have been referred from the job, maybe HR would have referred them, maybe court, legal authority, police. If they have relationship issues, especially with their partner, family discord, and these people end up in front of a mental health professionals. Here, the primary reason is autism. The secondary reason may be because of comorbidities. They do not come for with the problem with autism. They invariably land up because of bipolar disorder as a comorbidity, suicidal attempt, depression, anxiety disorder, and many a time psychosis. Invariably, the absence of intellectual disability and mild deficit with regard to social reciprocity will be the hallmark of diagnosis of autism in adults. That means they are high functioning, the IQ is well preserved, and they go undetected during their childhood. Now let's understand why there is a delay in presentation and diagnosis of autism in adults. First and the foremost, since they do not have intellectual disability or maybe mental retardation, they do well in education, and many a time they go undetected. Most of the time, they are well protected by the parents if there is excessive accommodation and they have resources to provide extra classes. A delay may occur because they are able to cope when their education and they are in a protected environment. During the second and third decade of life, the challenges which are there because of the occupation, doing higher studies, invariably competing with the best population, that is, postgraduates, they decompensate. During that time, they'll end up in front of a mental health professionals. Invariably, the comorbidities such as bipolar disorder, schizophrenia may also take them to mental health professional. Invariably, the exhaustion which occurs because of masking and camouflaging, which is these persons with autism will try to fit in with normal population. The more they wear the mask, more they do camouflaging, invariably the stress increases, anxiety increases, and invariably they go to depression. Many a time, the medical officer would have not been appropriately trained with regard to autism. Hence, there will be delay in referring to specialist or for the general psychiatrist. Increased cost of assessment, and many family members do not feel they need to invest so much of money. Stigma and discrimination with regard to approaching a psychiatrist or a mental health professional still haunts the society. Many a time, these pediatricians would have not even had a psychiatry postings, and they would have never been exposed to autism. These poorly trained pediatricians and many psychiatrists may not be able to pick up adult autism. Further, the predictable nature of our religion, culture, in such a scenario, the person with autism is well protected. Hence, the diagnosis will be missed. Many a time in developing countries, access to mental health care services, access to psychiatrists or mental health professionals is very minimal. In such a scenario, think about diagnosing autism in adult population. Let's look into this masking and camouflaging, which I was discussing. There are three important things which are well known. One is compensation, masking, and assimilation. What is compensation? Finding ways around things that are naturally difficult. Invariably, person with autism has to compensate, and they need to force themselves to make eye contact with others because their family members and parents will force them to do that. Masking, hiding the some parts of their autism, not talking about something they are really interested in because family members would have told them not to discuss about their area of interest, and they would have told them to just listen. And this are the condition they wear mask. That means it is a kind where they do not discuss about their passion. Assimilation, trying to fit in with everyone else so the people don't notice their difference. That is, even they do not want to talk to anybody, they are forced to talk to the strangers. These kind of camouflaging and masking is well known in autism in adult population, and they have compensated and they are trying to fit into so-called normal society. Now let's discuss about the prevalence of autism in adult population. Autism is present approximately in 1% of the general population. It is encountered in 3 to 5% of mental health service user. That means if you go to a psychiatric institution and if you do a study, invariably 3 to 5% of the population who seek help from a mental hospital will have autism. Autistic people are greater risk of having co-occurring psychiatric disorder. Hence, the diagnosis of autism increases. This we need to keep in our mind. Of late, the prevalence of autism is increasing across the globe. There are various reasons. One of them is diagnostic criteria have become broader. That means we have come up with autism spectrum disorder. Further, awareness about autism in general public and in health professional is increasing. Slowly, the decreasing of stigma for seeking help from mental health professional is also decreasing in metropolitan cities. Professionals are getting aware about autism, increasing social demand to perform in social situation will lead to decompensation with regard to people with autism. Accommodation, social welfare measures, disability pension, all these also play a crucial role in seeking help and also seeking social welfare measures. Now let's move into comorbidities, especially autism in adult. The most common diagnosis which is seen is depression and suicidal attempt, anxiety disorders, psychosis, catatonia, learning disorders, SLD, ADHD, especially inattentive type, gender dysphoria, OCD, PTSD are the commonest diagnoses seen with regard to autism in adult. Invariably, current literature says 50 to 70% of the autism in adult will have one or the other comorbidity. But however, invariably, the misdiagnosis also occurs with regard to autism in adult. Invariably, they present with comorbid psychiatric condition. Hence, the autism will never be diagnosed. That is one of the commonest. Premorbid personality will never be assessed properly. Even if it is assessed, they would label it as a AAPD, that is anxious avoidant personality disorder, schizoid personality disorder, schizotypal personality disorder, histrionic personality disorder, or various other diagnosis of personality disorder is given rather than autism. Further, if the patient does not improve, invariably they will consider it as treatment resistant schizophrenia or bipolar disorder. Many a time they don't entertain the diagnosis of autism as a comorbidity. Let's understand how to diagnose autism in adult. The adults, for the first time, when they report with comorbidities, we need to check for autism because autism is a lifelong neuro-developmental disorder. Invariably, most of them are struggling to fit into the society by either masking or camouflaging. Social isolation is very common, and children and also high school children are bullied, abused, and school dropout is very well known. And invariably, because of bullying and abuse, majority of the autism may have obsessive rumination with regard to abuse. Many a time, mental health professionals will get misled and the diagnosis of PTSD is done. However, if there is an independent diagnosis of PTSD is there, you need to be careful and we need to address this issue. Let's understand the management of autism in adult. Assessment of autism in adult relies on several factors. First and the foremost is good clinical and developmental history has to be taken. The history has to be taken from multiple sources, such as parents and particularly mother, sister, especially elder sister, relatives, friends, and if there is a colleague, that means if he is working in a office, please call them. More the multiple sources, that means you will get a good source of information. Past treatment details, medical records, if they are accessible, please go through them. Clinical evaluation and observation of person with autism is very essential. Presence of comorbidity may mask the autism. Hence, we need to treat the reason for presentation aggressively. If they have presence of diary or videos taken in a childhood need to be observed to make a diagnosis of autism in childhood, although they have presented during the adult. There are various scales available for diagnosis of autism in adult. The first and the foremost is Autism Diagnostic Observable Schedule, second edition, that is the commonest which is used, Autism Spectrum Quotient, Adult Repetitive Behavior Questionnaire, Adult Social Behavior Questionnaire, Ritavo Autism Asperger's Diagnostic Scale Revised, Developmental, Dimensional and Diagnostic Interview Adult Version, Social Responsive Scale, Autism Diagnostic Interview Revised Scale. These are the various scales which are available. Based upon the need and also the copyright, you can choose any of them. But the gold standard for assessment and diagnosis of autism is the combination of detailed assessment by a well experienced clinician, clinical observation, inpatient mental status examination, serial ward observation, administration of various scales, and interpretation of all these are very essential to make a diagnosis of autism in adult. We need to collate information from all multiple sources, multiple clinical scenarios, from various contexts. The assessment has to be done. Let's move into the treatment of autism in adult. Invariably, the medication and treatment is dictated by the comorbidity. If there is depression, you need to give SSRI. If the person has self-injurious behavior, suicidal thoughts, you need to press panic button, because a person with autism will never try to threat or use suicide as a threat. If they want to attempt suicide, they will do it with a serious intention, my dear friends. So whenever a person with autism discusses about suicidal ideas, suicidal thoughts, take it very seriously. You need to treat them very aggressively. Evaluation of these thoughts and behavior need to be done by ABC. That is, antecedents, behavior, and consequences need to be assessed for each of these behavior, challenging behavior, suicidal behavior. The risk of suicide by autistic person is substantially greater than general population, and it is more in women. That you need to keep in mind. And also, person with autism and ADHD are at high risk of attempting and committing suicide. Risk factors such as unmet support needs, excessive camouflaging, masking, having depression, anxiety are also the higher risk. Aggressive management of suicidal ideas should be done, especially in person with autism. If the person has aggression, challenging behavior, and self-injurious behavior, again, we need to do ABC analysis of the situation. You need to consider medication, especially if the person is very aggressive. Valproate is the commonest medication which is chosen in aggression, and many a time even antipsychotics such as risperidone, haloperidol are also chosen. And we need to keep in mind many a time this violence, self-injurious behavior need to be curtailed by using psychotropic medication. Further, many a time of autism, especially in adult, may present like OCD symptoms, or else, as I mentioned earlier, even as a PTSD. The reason being is these children, especially with child with autism, may would have undergone bullying from so-called normal children. This bullying and abuse may come as obsessive rumination in person with autism, and many a time this will be misinterpreted as either OCD or else PTSD. We need to consider them very seriously, thoroughly evaluate them, and we need to address them by psychotherapy. If the independent PTSD is there or OCD is there, medication can be considered. And please remember, if they are just the symptoms or obsessive rumination, psychotherapy does very well. Many a time, we need to understand the role of therapies. What are the different therapies are available? There is evidence-based therapies or so-called the early preliminary evidences which are there. There are 28 different therapies and 10 manualized therapies are available for autism. But let me remind you, at present, there is no one standard therapy which will fit all autism or autism spectrum disorder. The main reason is every person with autism is different. They are unique. Their experiences, their feeling, and their dynamic interaction with the environment changes day to day and also along with the family members. So, the most effective therapies and the interventions are often different for different patients. That means the intervention need to be tailored based upon the strengths of the patient, weakness, and available resources. I'm mentioning available resources. The reason being, if you don't have a trained human resources, or else if you don't have resources to pay for their therapy, is it possible? It is simply impossible. Hence, based upon the resources, you need to focus rehabilitation. The important thing is Treatment should be tailored based upon the individual needs, strengths of the patients and family members. Research have clearly shown that early diagnosis and intervention help. But people of all ages, at all level of ability and disability, do well with psychotherapy, my dear friends. Now let's understand the policies and laws with regard to autism. Here, there is an urgent need to train all healthcare professionals, policymakers, politicians with regard to autism, because 1% of the population, if they have autism, that means we are at the epidemic proportion. Although we have National Trust Act of 1999 for autism for providing guardianship, although this is a very old legislation, it is doing its some bit. But however, we need to have a comprehensive legislation for autism to provide services in the community, similar to Autism Act of UK or else Autism Act of Northern Ireland. Similar act needs to be drafted, which should be appropriate to your culture, our resources, at the same time considering our the background as a family where therapy can be done. Similarly, we need to come up with autism village or a autism county or a district where the person with autism can be made to stay along with their parents. They cannot stay in a place where it is highly sensory stimulation occurs, especially bright lights, musics, horn, and noisy places do not go well with the person with autism. Hence, we need to have a dedicated space which is quiet, calm, soothing for person with autism. Such place need to be identified and that need to be earmarked for persons with autism and their family members. To conclude, autism can be diagnosed even in adult, and the prevalence is around 1% in general population. Unfortunately, autism in adult is underdiagnosed, untreated, and poorly researched area, my dear friends. There is a need to administer autism scale in children to diagnose early, especially at the age of 12 months, 18 months, and 24 months. Comorbidities are the rule in autism, even autism in adults. Autism is a lifelong neuro-developmental disorder. Prevalence of autism is increasing slowly because of awareness and broader diagnostic criteria. Services, especially in adult autism, is very poor. Hence, we need to make efforts to provide services for autism and family members. Autism needs to be viewed from a lifespan perspective and approach. Hence, we need to provide services from womb to tomb with regard to autism, my dear friends. Hospital needs to be autism friendly, environment friendly, and they need to be facilitatory in providing services for persons with autism, my dear friends. Screening of children is essential, as I mentioned. Training of pediatrician, various health professionals need to be done on priority basis. We need to have enabling legislation so that we have a committed policy, and highly committed and also political will is essential to provide services for persons with autism and their family members. Healthcare professionals need to undergo training with regard to autism, especially doctors, pediatrician, and also psychiatrist, my dear friends. Thank you very much for giving your valuable time. Stay safe.